Well, starting as an otolaryngologist, I noticed weight impacting their health because they had sleep apnea. And their spouse would notice that they snore, but they were tired all the time. They didn't feel well. They had an increased incidence of heart disease. Do you know if you have sleep apnea, on any given day, you're 7 times more likely to die than somebody who doesn't have sleep apnea? So how do you treat it? Well, in the old days, we could just cut a hole in your neck and that fixed everything, but most people were not enthused about that treatment. So then we developed CPAP machines, and these are mechanical respiration devices which literally blow air through your mouth all night or your nose all night. Well, many people are not enamored with the idea of sleeping with a machine. The other solution for them is to lose weight. If you take off 30 or 40 pounds, the chances are excellent you will cure your sleep apnea. My name is Frank Douglis. I am an MD, and as an MD, I'm a board-certified otolaryngologist. I'm also board-certified in sleep medicine and in obesity medicine. So in my practice, I treat ear, nose, and throat problems, but I also treat sleep problems. And since most of my patients are obese, and since obesity impacts all the other problems, I treat a lot of obese patients as well. Ironically, I didn't really make the decision to put the Ideal Protein into my practice. I lost the weight on Ideal Protein. I was delighted with the results. And when the salesman came to my office to get me started, I showed him my new physique and assured him I was quite done. Thank you very much. Fortunately, my wife was standing there, and she pointed out that for 20 years I had told people they needed to lose weight and nobody ever had. And she said, you've got a tool that works and you're going to hide this from your patients? I don't think so, because if you're not going to put it in the practice, I will. And she did. Ideal Protein is so effective because, unlike other weight loss programs which just rely on hypocaloric systems, which means low-calorie systems, and face it, you could lose weight on a chocolate chip cookie diet if you just ate one chocolate chip cookie every day. Ideal Protein has a macronutrient content. In other words, they have looked at the ratio of protein to carbohydrates to fat, and they have set that up in such a way that your body's natural mechanisms assist you in burning fat quickly and losing weight quickly. So the Ideal Protein protocol is unique because it combines the behavioral part of the protocol, which is trained coaches teaching you what you need to do. Because, especially for maintenance, if you don't know what to do to keep the weight off, if you don't know what to do to take the weight off, you won't be successful. We teach you how to be successful, and we combine that with a specially engineered food that provides a combination of macronutrients which are designed to turn on the body's fat-burning mechanisms so you'll lose weight quickly and safely. And by the way, you preserve lean body mass, which is essential. Ideal Protein says weight loss is healthcare because it really is. Hippocrates said, let your food be your medicine and your medicine be your food. So that idea has been around for a long time, and it really is true that your body is physiologically set up to keep you alive in very diverse circumstances. However, if you want to be alive and healthy, then the food that you eat is incredibly important. If you live in today's world, the food that surrounds you is not healthy. And Ideal Protein is set up to rectify that imbalance and to restore a healthy state for you. So if another healthcare professional asked me about Ideal Protein, I would strongly urge him to add it to his practice for a number of reasons. For one thing, he'll be doing his patients a real service. Number two, it's a business that will add money to his practice. So he will do well by doing good, if you will. So there's really not a downside to Ideal Protein. It's a service. Healthy weight loss is a service that patients require, and they can either get it from his office or he can send them down the street. Financially, I think it'd be better for him to just put it in his office.